The CDC director is responding to confusion and criticism over new isolation guidance. The agency recently reduced the number of days that people who test positive for COVID should isolate if their symptoms are improving. It is now down from 10 days to just 5. Initial guidance said a person did not need to be tested before leaving isolation. The CDC now says antigen testing is the best approach, but it is not required. CDC Director Dr. Rochelle Walensky joined CBS Mornings earlier today, and she defended the new recommendations.
What we know is that for the 1 to 2 days prior to your infection and the 2 to 3 days after your symptoms, you are maximally infectious. That's when your biggest infectious and contagious period is. By day 5 after your symptoms, most of that infectiousness, that contagiousness is really behind you. And that's really where we say, do you have symptoms? If your symptoms are better, you're safe to go out as long as you're wearing a mask all the time. Now, what we heard over the last week is many people were interested in using an antigen test. They had access to the antigen test. So we did not pivot our recommendations. What we did is we provided guidance for how you'd use and interpret that antigen test if you so chose to take the extra step to get one. And that is, if it's positive, stay home. And if it's negative, please continue to wear your mask, because that does not mean you're no longer infectious.
Dr. Bob Lahita is with us now to discuss the latest coronavirus news. He's the director for autoimmune and rheumatic diseases at St. Joseph Health and the author of a new book, Immunity Strong. So a couple of things, Dr. Bob, that we want to dig into. First of all, let's get your take on Dr. Walensky's explanation. Do you find Sorry, I was going to say, do you find the CDC guidance confusing? Because a lot of people seem to.
It is a bit confusing, and although she's been very clear over the last 48 hours, and that is that, you know, the curious thing is that you can be asymptomatic and still be infected for about a day or so, and then you develop your symptoms. When the symptoms go away, what she is saying is you wear a mask and stay put for 5 days, and that includes the first day of symptoms. And when everything goes away, then you can go out in the public as long as you wear a mask. That's after 5 days. Now, one of the reasons for this, Vlad, is that we've had a shortage of nurses, doctors, firemen, police officers, EMS workers, all because they have been out for 10, in some cases, 14 days and acting as though they were consistently infected, both to their families and to people on the outside of their homes. So I can see where she's coming from. This includes airline pilots, by the way. So, you know, once you're symptom-free, and that's the key, symptom-free, you can, after 5 days, you can get out of your house. You must wear a mask, but you can get out of your house, but wear a mask for 5 days. My suggestion is wear a mask for longer than 5 days, especially when you're around crowds.
Okay, so then, I don't want to be nitpicky, but I am going to be. You know, what she said in that interview right there, though, was after 5 days, if you feel better, which I find to be a very vague term. That's different than if you have no symptoms. And most of us, when we get sick, it's not sort of like we're under the weather and then there's a line in the sand and suddenly we feel 100%. Usually, you know, as the days progress, you get a little bit better, and maybe by day 5, you're 80%, whatever that means. So that's why it's still confusing to me. Doctor, so I would have been more comfortable hearing, you know, after 5 days, you are 99% less infectious than you were in the beginning. So I want to ask you about the infection rate, infection levels. Can you sort of give us a better sense or be more precise about when we're most contagious and when we're not?
Well, this is based on data from the CDC, and you have to understand that that's data. So I have in front of me here a series of graphs, which I could easily show you, and these graphs are very, very clear about when the antigens disappear. That's the virus. That's the antigen. It goes away after, I mean, you're still possibly infected, and it varies from individual to individual. But for the most part, if you have no fever, no aches, your sore throat is gone, after 5 days of wearing a mask, you have to continue to wear a mask even though you're out and about. That's what they're saying, and that's what the data show, that the antigen curve comes down so that the virus is essentially now waning inside of your body. It is no longer there in massive amounts, and that's what people need to know. So you can home test. The government is saying you don't have to test after the 5-day period. But that's a bugaboo right there, because people are really concerned about that. And they're going home and they're saying, well, let me do the home test to see if I still have the virus, see if I'm shedding it. And that is very, very important. And that's what the CDC did not say. It's not necessary to take a test after the 5-day period.
So a couple of things. First off, Dr. Bob, we do have some news that we can report now, which is that the FDA has shortened the interval for booster doses of Moderna, the Moderna vaccine, to 5 months. That is some news that just crossed the wires just momentarily ago, just a few moments ago. But it's interesting that they're sort of shifting, and I understand, and we have to be, I think, it's important for us to point out that when some people will look at what the CDC is saying, that they think that they're somehow shifting the goalposts or moving the goalposts. But when you understand the nature of the threat as it evolves, as we evolve in terms of the vaccine, we are vaccinated now. Many Americans are vaccinated and have received boosters. It's a very different landscape than it was back in March of 2020, right? So I understand that. But as Anne-Marie points out, when the CDC says, if you feel better,
yes,
it sort of flies in the face of logic, because when they say that if you are a vaccinated and boosted individual, you're not going to get really, really sick. You're not going to be hospitalized. Some people will say, I was really sick, but the medical term for being that sick may not be hospitalization or dire straits, if that makes sense.
Yes, that's the vast majority of people who test themselves at home with the antigen test are never going to go to the hospital. They're probably not even going to go to their doctor's office. In my office at the Institute, we're hearing from patients all the time who are saying, I don't feel well, I feel sick, I haven't tested positive, but I'm not coming near you. And that's a good way to think. Because if you have any symptoms, and I think symptoms is the key here, and what are symptoms? Muscle aches, sore throat, runny nose, headache. If you don't have any of those symptoms, what the CDC is saying, you can now, after 5 days, go out and wear a mask and be among other people. And it's a personal choice. And I agree with you. It is a bit vague. It would be better if you could have your physician say, OK, you're antigen free right now. You can go about your business. But that's not what is happening at the present time. And it's a little bit confusing to everybody.
All right, doctor, let's get into some of the latest news on vaccine development. Pfizer says that its COVID vaccine is not yet ready for kids under the age of 5. When it is, it's likely to be a 3-dose series. Can you explain why developing a vaccine for this age group is taking a little bit longer than others?
Well, because they gave the kids, we get 50 micrograms to 100 micrograms of antigen. That's the viral particle in the little capsule, the RNA, messenger RNA. But children get about half that dose, and kids that are really young, between 2 and 5, are getting 3 micrograms, and their immune response has not been that robust. And that has been a concern of some of the investigators. So they're now cranking up the antigen to be a little bit more. And, children have very vibrant immune systems. They have immune systems that respond to everything as well as way it should be, rather than, say, somebody over 65 had 70 or so, where the response is not that great. But children, they're trying to tweak the antigen load for the child to make sure that the child mounts a very good immune response. And that's where the research is right now for that little age group between 2 and 5. From 5 to 12, the half dose that the adults get is more than sufficient to provoke a really good, robust immune response.
So, Dr. Bob, earlier I asked you a long and rambling question, and I apologize for that, but you can clearly tell that I'm not a scientist or a doctor, which is why I was trying to put those words into proper English, and you've written a book for people like me. It is called Immunity Strong. And something that's really fascinating in the book, it's a recurring theme in the book, it's something that you call biological soul. Explain what that means and how it impacts immunity.
Well, your immune system is critical to you. It's one of the largest systems of the body. It permeates every organ from the brain down to your skin. If that breaks down, you have a problem. And the whole business of vaccination is to provide the biological soul. There's a spiritual soul, too. A lot of people don't believe that. But there's a spiritual soul, and there's the biological soul, which protects you. Its goal is to keep you alive well beyond 100 years of age. And this involves everything. And what we do with vaccines, for example, is we boost your immune system and we make that protection network, which I explain in very simple terms in the book. We make that system robust and we make you almost impervious to any kind of infection, particularly the COVID. Everybody wonders why some people do really well and other people wind up in the hospital and some in the ICU. And of course, the tragic thing is some die. So I talk about this biological soul because people understand that. It permeates our body. It's responsible for protecting us. You can nurture it with exercise, diet, de-stress yourself. You know, distress really lowers host resistance. Everybody knows that when you have a divorce or you lose a loved one or you have a terrible exam to take. This is what the immune system's all about. It is the most complex, but yet I simplify it in the book to make you understand how it works. And the vaccines are very safe. And a lot of people don't understand that. They don't understand how your protective network works. And that's what the book is all about. I'm trying to make it very clear so people understand immunity.
I really like that, Dr. Bob. I think that, you said everyone knows that stress has an impact on your immune system, but I think it's sort of like more like a feeling or anecdotal. I don't think people realize that there's actual science, documented science behind it.
Yes.
And so I think it's a great concept for a book. And I wish you much luck and success with it. I hope people buy it.
Thank you, Anne-Marie.
And so,
Dr. Bob.
Sorry. So I was just going to ask Dr. Bob real quick before you go. You have an entire chapter actually on COVID-19 vaccines, which detail the history of the vaccines. And you even explain how mRNA shots work.
Yes.
Why did you choose to include that information? What do you hope readers get from it?
Well, Vlad, this book is in response to hundreds of patients who have asked questions both by email and also in person. And I realize that people are very confused, and a large part of vaccine hesitancy among people is the lack of understanding of how vaccines work. And because we're in the molecular age, and I'm really excited about that, we could produce a vaccine within 4 months, only because we're very, very smart molecular biology-wise. And this is what is the new concept. The messenger RNA thing is not very new. It's about 15 years old, but we've applied it to produce vaccines which are exceedingly effective and extremely protective. And so if you're hesitant to get the vaccine, you shouldn't be. It's very, very safe, and it really boosts your biological soul, if you will. They are really, really important to protect your life. And people who have lost loved ones to COVID and themselves are suffering from the long haul effects of COVID will appreciate what I'm saying. It's nothing to get a shot. It's sort of like boosting your jet engine with fuel. And this is very, very important. And I explain it very simply in the book. And I think it's worth reading.
I love it. Dr. Bob Lahita, thank you very much.
Thanks, Anne-Marie. Thanks, Vlad.
So just a reminder, Dr. Lahita's book, Immunity Strong, is available right now.